Fecal incontinence is accidental bowel leakage. There are three main reasons that we can lose stool, and one is that the sphincter is damaged and does not close properly. This usually, the most common reason for this happening is following childbirth or after surgery. The rectal reservoir, or what holds the stool prior to a bowel movement, does not expand anymore, and that's very common after surgery or radiation. And finally, the sensory component, where we sense that the rectum is full and it is time for the trip to the bathroom, that doesn't occur until it's too late. Essentially, the rectum is overloaded and there is no time to make it to the restroom. So those three reasons are why most people will have a chronic accidental bowel leakage. How common is accidental bowel leakage or fecal incontinence? Approximately 8% of the general population has this accidental bowel leakage. The majority of these patients are women. Because of the birthing process, the nerves and muscles are injured. There are other medical conditions that can also lead to patients dealing with fecal incontinence. It's obvious that this would be a devastating thing in any one of our lives. We would become recluses. If we went anywhere, have to carry a change of clothes with us. Most patients, because of the fear of odor and just the inappropriate timing of the loss of stool, they remain home and separated from their families. The Fenix device is placed by surgery. The patients are in the operating room, either under general or spinal anesthesia. It is placed through an incision between the rectum and the vagina. We have a sizing device that helps us select the appropriate size of the Fenix. Everyone's size of rectum is a little different. And the patients stay overnight, and their healing process is usually between 4 and 6 weeks. What makes the Fenix device so important is how devastating fecal incontinence or accidental bowel leakage is to the individual. Again, most of these patients are women, but men and women are affected by the same problem. Unfortunately, our conservative efforts are not always successful or only partially successful. And at this point, the Fenix device is the only option a patient has if they wish to not deal with the reclusiveness, the isolation, the embarrassment of this problem, and a colostomy. Again, it's only proposed to a patient when they've failed the conservative efforts, and that again is the physical therapy, the medications, trial of InterStim, and if all of those fail or do not give the patient the quality of life that they're looking for, then we would suggest the use of the Fenix device. Most of the procedures at this point have been carried out in Europe, and there were approximately 35 patients that this procedure has been implanted in Europe, and it's close to 90% of those folks found a greater than 50% reduction in their daily and weekly stool loss. So it's been, for these patients that have nothing else to be offered, it's been a wonderful treatment.